What kind of risk factors do we see for CINV, Becky?
So I think we've identified several risk factors. There are patient-related risk factors and then treatment risk factors. For those patient risk factors, I think we all are aware that younger people, especially younger women, are more susceptible to having difficulty controlling CINV. We know that our young women with breast cancer in particular definitely have more of an opportunity to have a problem if not receiving adequate treatment. Motion sickness is part of a history that we take with patients. Those patients who have a history of a high alcohol intake surprisingly have less of an opportunity, or not an opportunity, but less of a risk of having emesis. Having said that, we still need to treat those patients with the most appropriate antiemetics as well. As far as treatment-related risk factors, definitely those drugs that are likely to cause a good deal of nausea and vomiting, those highly emetogenic agents, as well as the moderately emetogenic agents. So we do tend to look at antiemetic regimens primarily based on the treatment-related factors, but we also need to look at patient-related factors as well and sort of combine all of those.
Great, thank you. So thinking about these different categories, Charles, can you tell us a little bit about which drugs that we commonly use fall into the highly emetogenic category and which fall into the moderately emetogenic category?
Yes, let me try to do that, and let me actually back up a little bit if I can. In terms of the risk factors for the morning sickness, I think also fits in that
Yes.
list some. And I have a hypothesis. It's never been shown that I think it's going to also would show it. I suspect that if you get sickness from anesthesia-related nausea and vomiting, you're probably going to get sickness from this third thing. It's both how you respond to toxins. The only time I ever had general anesthesia, I threw up for 12 hours. And I've never had chemotherapy, but I suspect I'm going to have problems. And I have motion sickness too. So the other thing that I found interesting on the alcoholics seem to have less nausea and vomiting. This was came out in about 1982, and I know because I was 81 or 82, I was a resident when it came out, and New England Journal letter to the editor. And they actually hypothesized that the reason this was is because they thought the alcoholics had burned out their emetogenic center.
Right.
I have a different hypothesis. I would never become an alcoholic because I can't have more than a drink or two of wine before I get I get sickness from that hangover at the middle of the night. And so I'm sensitive to that thing. I think that people who are sensitive to it will never become chronic alcoholics. Mm-hmm. And so that might be the rationale for it, mm-hmm. for that. Never been proven on that sort of thing. So cisplatin, in terms of highly emetogenic chemotherapy, the one we think about most is cisplatin. More than carboplatin, which fits in the moderately emetogenic, and more data recently that has caused a bit more nausea and vomiting than we like, even with our moderately emetogenic regimens that we give. And then AC is an interesting group, adriamycin and cyclophosphamide. And for a long time, that was considered moderately emetogenic. Mm-hmm. But it really is highly emetogenic because it's women, young women with breast cancer oftentimes, women with breast cancer, and it does cause a lot of trouble. And for a while, some of the guideline committees said, well, let's move it to the highly emetogenic. Another committee says, no, we called it moderately emetogenic, but we're going to say for our highly emetogenic and the AC moderate emetogenic, we're going to treat with this thing. But I think it really is highly emetogenic. Mm-hmm.
And it's really the one category where we have two drugs together as opposed to just listing them by individual drugs because of that interaction, as you say. What other drugs are in the moderately emetogenic?
So just backing up a bit, I think the opportunity with, highly emetogenic is defined as greater than 90% risk, and then moderate with this 30% to 90 is so broad, and those of us interested in the topic sit down and debate these things. But I think that's a real area that we need to think about further and research. And the other personal risk factor that I consider, and I'm seeing more and more in my practice, is just anxiety. These patients that tend to be really anxious and are worried about nausea and vomiting, it almost becomes a self-fulfilling prophecy that they're going to have that bad experience. So I think it's something for us to really think about. I kind of describe them as my nervous Nellies. I kind of know how they're going to do, and I'm usually more aggressive about how I treat them.
And you might use different categories of drugs to treat the anxiety, which is an overlay, in a sense, over the physiology.
Yeah, and then to Jim's
Yeah.
point about anticipatory nausea, I mean, everyone has these war stories about patients who just have this conditioned response, and it can actually be really disturbing, from a smell to driving by the cancer center, or one of my favorite ones is one of my bosses is a breast oncologist, and she saw one of her patients in the supermarket, and just looking at her face, she vomited right there in the supermarket, which you know, she doesn't take personally. It's just this, like, it's so conditioned. It's really amazing
It's
that
real.
you're so hardwired to have such a bad experience.
Hearing that makes me feel better, because I thought I was the only one that people vomited when they saw. So that was.